Hello everyone, my name's Joe. I did rheumatoid arthritis, also known as RA. As you can see here, this is the normal joint. You have the tendon and the muscle, and the bursa over here provides that soft cushion. Over here is osteoarthritis. You can see the cartilage, which reduces the friction and the impact of the joints. It's basically non-existent. See the bones rub together. And then for rheumatoid arthritis, you see the bone erosion, and the synovial membrane is inflamed as well. So definition overview. RA is a chronic, inflammatory, and systematic autoimmune disease that can lead to permanent deterioration of the joints. If continuous inflammation persists, the outcome leads to extensive joint damage and functional impairment in a wide population of people. This disease is quite dangerous because it can cause deformity and disability of the diagnosed patient. RA also affects 1.5 million Americans, and also women are 3 times more likely than men to contract the disease. Signs and symptoms. RA has a likelihood of not showing any apparent symptoms of the joints. The early signs and symptoms may occur with or come before joint stiffness, which is observed upon rising up in the morning and periods of inactivity. Edema, pain, tenderness, and warmth in one or more joints are happening in a systematic pattern slowly emerge as the principal symptoms. Frequent joints that are impacted are wrist, knee, ankles, knuckles especially, and toes. The initiation varies to all patients with age, but usually signs and symptoms surface when individuals reach their 30s and 40s. Systematic factors. Systematic implications arising from RA are severe. Inflammation of RA affects multiple organs, including the brain, exhaustion, and diminished cognitive function, liver, elevated acute response phase, lungs, inflammatory and fibrotic disease, exocrine glands, secondary Sjogren's syndrome, muscles, sarcopenia, the heart, MI, myocardial infarction, heart attack, arising from arteriosclerosis, CVA, stroke events, and heart failure, and also bones, osteoporosis. In addition, higher rates of lymphoma and lung cancer appear to have a correlation with RA. Primary causes and contributing factors. The underlying cause of RA is unknown. RA contributing factor is primarily focused on the premise of the clinical phenotype and involves an intricate interchange between genotype, environmental triggers, and chance. Genome-wide, which is finding associations between genetic variations and traits, and analysis provides substantial evidence that immune regulatory factors underlie the disease. The widely held association with human leukocyte antigen, HLA-DRB1 beta chain, locus, has been confirmed in patients who are positive for RA. Alleles that have common DNA sequence motif in the HLA-DRB1 region regarded as shared epitome carry considerable risk because of the high number of RA patients who possess this gene. Mainly, the HLA-DRB1 gene carries out instructions for creating a protein that serves a vital role in the immune system. The HLA complex assists the immune system to differentiate the body's own proteins from proteins made by foreign living organisms, such as bacteria and viruses. Patients with RA do not have the ability to differentiate these foreign substances. Diagnosis. The diagnosis for RA follows a criterion on a scale of 0 to 10 points with 4 separate categories of signs and symptoms, which are joint involvement, serology, duration of synovitis, and acute phase reactants. A patient with more participation of the smaller joints will receive more points, 0 to 5, compared to large joints. The number of points, 0 to 3, for serology is determined by the presence or absence of anti-cyclic peptide, which is a blood protein, and rheumatoid factor, another blood protein that is capable of attacking your immune system. The calculation of points for synovitis 0 or 1 is established if duration lasts longer than 6 weeks. Acute phase reactance points 0 to 1 are confirmed if either C-reactive protein and erythrocyte sedimentation rate, measures that are both used to reveal inflammation in the blood and body, are abnormal. Patients are diagnosed with RA if they score 6 or more points by the 4 domains of the criteria. And then just, as you can see here, this is more of a visual representation. You can see the joints, the neurology, and the joint involvement counts for the most. Management treatment. Patients with at least one infected joint may need disease-modifying therapy, anti-rheumatic drugs, DMARDs. The functions of these is to decrease pain and inflammation, minimize joint damage, and protect joint integrity. Medication comes into effect weeks or months later and is not used to treat immediate relief of symptoms. Other medications, such as ibuprofen, aspirin, are given as a means of quicker relief. DMARDs are taken in conjunction with these drugs to lower the sum of antibiotics needed and to avoid joint damage. Prognosis. The prognosis of RA relies on the effectiveness of treatment, which includes a personal discussion between the patient and physician who is competent in the area of rheumatology. Early medical treatment is decisive for a desirable outcome by the patient. Without aggressive intervention directed against the excessively active immune system, joint deterioration, deformity, and disability are the consequences. Without aggressive intervention directed against the excessively active immune system, joint deterioration, deformity, and disability are the consequences. It is advised to have a rheumatologist on your side as a member of the healthcare team. ICF model. Health conditions are body structures and functions that are affected: circulatory, immune, lymphatic system, musculoskeletal, integumentary, nervous system, and are more likely to end respiratory system. Activities: grabbing and holding items, maintaining posture, fine motor mobility in day-to-day operations, just patient hygiene, bathing, showering, etc. Leave of absence from occupation, like computers or mechanic, socialization, hobbies, and sports. Personal factors: age, weight, smoking, alcohol, gender, and genes. Environmental factors: exacerbated pain due to weather. It's also really important to have a good support system at home. Happiness is critical. Layout of the house is food, beverages, utensils in an organized manner to avoid pain. And then also before closing out, there was someone that died, not recently, but he had RA, and the complication he had was non-Hodgkin's lymphoma. And, he really was altruistic and respecting of people, and he was a really good person. So that's the end.